Today we have Dr. Mona Tareen with us. She is a triple board certified physician in internal medicine, palliative care, and geriatrics. She trained at the University of Chicago Hospital in internal medicine, followed by a fellowship at Rush University Medical Center for Geriatric Medicine and Palliative Care Fellowship at Midwest Hospice. She was a professor and director of palliative care at Rush University Medical Center and presently works as a palliative hospitalist and geriatrician at the American Hospital in Dubai, with a master's degree from University of Maryland on Cannabis Medicine. Thank you so much for being here with us today, Dr. Mona.
Thank you so much. It's my pleasure.
What would you say is the evolving role of cannabis in healthcare?
Oh, you hit my soft spot.
It's a loaded question.
Okay, if I get arrested, you'll find out soon enough. It is a loaded question, but you know, the beauty about talking about cannabis, so as you know, my background, and I do believe everything in medicine should be evidence-based. So they've already approved cannabis in certain conditions. One is chemotherapy-induced nausea, vomiting. The other is pediatric epilepsy. And there's one more indication in pain. But it helps to, you know, if you have pain syndromes, it helps to go to someone who's qualified in it, because you have to understand, one, the combination that you're going to use. So there's one CBD, which is not psychoactive, and I'm going to use the word make you euphoric, and the THC, which does. So if you have someone who's got the experience, you'll know the combination to use. So if you're going to use it for insomnia, are you going to use it for numbness in your legs, for peripheral neuropathy? Are you using it for arthritis? But you need someone to talk about the drug interactions and the side effects, and that the studies in these fields are actually still evolving. So I think it's going to probably develop more. I think there's more research looked into it. European studies tend to be a lot stronger than the American studies. No pun intended, but that's the way it is right now. So I think there's a lot of room for that. I think it can be an option for patients, but older adults, I'm going to emphasize again, do not walk into any dispensaries that you don't know. You have to know what you're getting, and you should go to a physician, and we're known as cannabis clinicians. You have to talk to them before you go that route, because it can interact with your medications. It can drop your blood pressure. If you had a heart attack, it might not be something that you want to take. So they have to know that this drug, what it may do and what it may not do for them.
That's a great point. When I guess in today's culture, when we mention cannabis and associated substances, it's taken in more of a social context, in more of a recreative context. And I would ask you, in your experience and education in this field, how far are we realistically from seeing cannabis in pharmacies prescribed, you know, on a global scale to patients?
So I think, so it depends which part of the world you're in, and you mentioned global. So, you know, the United States has dispensaries, but you won't see it in a pharmacy unless there is a company that's willing to develop it. There is one pharmaceutical medication for childhood epilepsy that's approved. And then there's another for appetite stimulation for cancer patients and also for HIV. So I think we're certainly getting there. I think it's all about patient choice also. We've had patients, you know, when you look at the endocannabinoid, because we have our own natural endocannabinoid system in the body, there are things that sometimes feel off, and you just have to find the right combination. So pharmaceutical-wise, I think it's a long ways to go. But if you find a physician who knows the combination and can talk to the dispensary, then they can meet that criteria and give you the combination that you need.
And when we, let's say, get to that stage where it is a lot more accessible, acceptable, particularly in the field, in different parts of the world, what would you like to see? How would you like to see it being used for your patients, for example?
Yeah. So for me, it would be, I would say, patients who have a complex chronic illness. And I know I tend to say this a lot, but I'm looking at people who have an illness with either, may have a terminal diagnosis, may need palliative care, may or may not be at end of life. And the reason I say this is because we're using a lot of medications for a certain symptom, yet we have one medication that can target a slew of symptoms. So I think at some point it will meet the criteria to be in what we call the palliative care toolbox. I think it's only a matter of time that it will get there. The other thing I wanted to emphasize, and I'm not sure I mentioned this, is older adults do have to be careful with smoking cannabis. And the reason we use the word cannabis instead of marijuana is because it is a medical, it is a therapy for patients, and it can cause emphysema and difficulty with breathing. So that's just one thing I wanted to throw out there. I know you didn't ask, but as much information is useful or as possible.
Thank you. I think that's a very hopeful message and gives us a lot of idea of what to expect in the medical field when it comes to the role of cannabis in healthcare. And it sounds very hopeful. And I think that's something we can all look forward to for the betterment of treatment for patients. Thank you so much for being with us today here at Dr. Mona.
You're welcome. Thank you for having me, and thank you, Health Bank.
This podcast is brought to you by the Health Bank Global.